Roy Brotman, again, the recovery coach. In this video, I'd like to speak a little bit about medication-assisted treatments. First, for alcohol use. The most popular medication that's given for alcohol abuse is something called antabuse. While this isn't a medication that will stop you from drinking because of its action, what it does is makes you violently ill if you do ingest alcohol. Now, there are some drawbacks to this. If you use some type of cologne or aftershave or perfume that's heavy in alcohol, it will make you sick. In some cases, it's been told, and I don't have any information that really backs this up, that if you have something in a restaurant that uses alcohol and alcohol isn't burned off completely, it might make you sick. Another medication used for alcohol is something called Vivitrol. This is an injection, usually an injection that's given once a month, that does reduce the urges for alcohol. It will reduce the urges, but again, as any medication, as the Vivitrol wears off in your bloodstream and wears off on your body, your urges will return. Something like Vivitrol, though, as you use it more often, your urges tend to diminish anyway. So after a few months of treatment, you may not need the Vivitrol anymore. Vivitrol actually also works in some cases of opioid use and benzoid use, tranquilizer use. More common in opioid addiction is methadone. That's been around for many, many years. While methadone doesn't help you relieve your use of drugs, it is an opioid. It does reduce the need for drugs like heroin, street drugs, basically. It's only given in treatment centers. You can't take it home with you or use it, on your own. Another drug that is now commonly given for drug abuse is something called, several drugs, Suboxone, Subutex, and a new one called Zubsolv. There are buprenorphine medications, some with Naxalone, which prevents abuse if you snort it or try to inject it. There are about 60 to 70% of drug counselors, registered drug or certified drug professionals favor medicated assistance for drug, and some don't. They claim that you're replacing one drug with another. I happen not to agree with that. It's much safer than trying to go cold turkey on either opioids, or even more dangerous to go cold turkey on is alcohol. So again, these are alternatives that you have. As a recovery coach, I'll help you make. I'll lead you or help you make the decision. The decisions are obviously always up to you, but reach out to me. I'm available by email and phone, and please call me if you have any questions.